I was perfectly well person. While I was on the basement of my house, I suddenly felt like a warm belt around my lower abdomen and the need to go to the toilet. I suddenly have a very, very strong pain, never had before, all around this part of the abdomen and going to my legs. I didn't move, I didn't felt anything, I have no strength. I become paraplegic completely. And suddenly my wife just saw in the internet an announcement about your clinic. I started seeing your videos in the internet and I saw that it was different and they explained very well what was the treatment. I said to myself, I should try. Here, I'm very pleased with everybody. Every personnel is very, very kind. Always looking if I need something, if I'm looking how the treatment is going.
Pleasure to see you here today, sir. Can you please introduce yourself for our viewers and tell us what brought you to Swiss Medica?
Okay, I am a Portuguese man. I'm a retired surgeon. I am 74 years old and I live in the south of my country in Algarve, in a city called Lagos. So I was perfectly well person till 31 of July the 2022. I was doing all my normal life. In that morning, it was a Sunday. I just washed my two cars and I washed another thing. And while I was on the basement of my house, I suddenly felt like a warm belt around my lower abdomen and the need to go to the toilet. I just start climbing to the first floor, to the ground floor. I went to the bathroom, just starting to lose the strength of my legs. I go to the bathroom, I had feces and I have urine, but I lost the strength of my legs first. I asked my wife, she took a wheelchair and I went to a room just near the bathroom and I went to bed. I called a colleague of my own hospital, which is in Portimão, which is for about 20 kilometers from my house. And because I have a lumbar hernia at level L3, L4, I suppose this was related with my hernia. And I asked him that I need to do some kind of scan, maybe a TAC scan, and to see if there is any special damage on my spine. And he phoned me a few minutes later, telling me this is for about 12 o'clock, and he told me that I must go to the hospital at 4 o'clock to do the scan. And then I thought that maybe, well, if it is at 4 o'clock, I have to eat something. And I tried to go from the bed where I was. In that position, I have no pain, and I could not move, but no pain, but sensibility on the legs. When I tried to go to the wheelchair again, after I've been seated, I suddenly have a very, very strong pain, never had before, all around this part of the abdomen and going to my legs. So strong that I have to push me out of the wheelchair to the floor. And when I arrived to the floor, I didn't move, I didn't felt anything, I have no strength. I become paraplegic completely, below the umbilicus. So I asked for an ambulance, I went to the hospital, and on the same day we started by a CAT scan. And my colleague just called a neurosurgeon in another hospital, and he told him that probably the origin of the problem should be a little higher than what I supposed. So I have done an MRI, and they think that the problem goes at level T10. But they don't know the reason for that, because I had no accidents, nothing like that. And they thought that I must do arteriography, directed to see how was the circulation. And because I couldn't do that in Algarve on that Sunday, I asked my chief and colleague at Lisbon, in the insurance company, that I need to go to a private hospital in Lisbon to do this arteriography. And I have to wait one more day, and on 2 of August I went to Lisbon. When I arrived to Lisbon in the noon, they just make the arteriography and saw that the only arteries that are blocked are at level T12, both sides. All the other arteries are correct, no problem at all, no problem in the aorta, no problem in the kidneys arteries, nothing. Everything is okay, over and down, only that level. But it makes an ischemia of level completely T10, but sometimes it goes a little over to T7 and below to T12. So I stay in that hospital, and after 10 days I began to have an ulcer in the coccyx, and the ulcer continues to grow. And at the 27th of August I had a first surgery to trying to remove the scar and do some changes with the plastic surgeon. But they didn't took too much of my blood tests, because when I arrived I was with the perfect numbers of my blood tests, hemoglobin, proteins and everything like that. And when we do the surgery on the 27th of August, they saw that my hemoglobin have lowered to 10.8. They never asked the proteins, only on the next day after surgery, and my proteins became too low. Albumin 2.2 and the maximum proteins 5. So no possibility of healing the surgery I have done, and it becomes to be necrosis. So they decided to just change bandage every day, and I decided with them that if it is to change bandage, I should not be on a private hospital. I go to my own hospital in Algarve, and in 14th of December in the morning, they took all the tissues that were around the scar. It was a big scar like this, and they put a vacuum compress procedure, and I come to Algarve to my hospital. I stayed there doing that procedure for at least 1 month more. And then the plastic surgery came and saw me again, and they say that because of the bone of the coccyx and the end of the sacrum, that will not heal completely, never. I have to do a procedure, a plastic surgery, two big, how can I say, they have to make 2 big incisions with muscle and skin and fat to cover that. I have done that in the beginning of November, and because of that I have done no physiotherapy during those times, and it's healed till the end of December, And on the 4th of January, I went to physiotherapy hospital in Algarve, just for physiotherapy, to recover position, muscles, strength, and things like that. I was in a general bad condition because I could not eat the food that they gave me in the hospital. It was not good. So I became anemic. I have to have some, no transfusions, but some iron, some vitamins, some supplements. And when I arrived to the rehabilitation clinic, after 1 month I had the same problem because the food was not good. And they suspected that I have some other problems like bone cancer or something like that. They start doing a lot of procedures, and I was telling them no. The reason for that is because I cannot eat, so I'm becoming anemic and I cannot improve. So they start giving me a lot of things to improve what I eat. And I stay in the clinic, and I was improving in strength and movements till the end of March. In the end of March, they said, well, you cannot do anything more here. You can move to your house. And because you have physiotherapy just near your house in Lagos, it's my town, you can go home and go to physiotherapy. And since then, all I have done is physiotherapy 3 or 4 times a week, most of them at home, and I improve my alimentation. Of course, it was different. It was prepared at home. It was with things that I liked, and I recover the anemia completely. I recover my proteins, and suddenly my wife just saw in the internet an announcement about your clinic. And she first tried to make an appointment with you, because while I was in the rehabilitation clinic, I have seen some things about stem cells done in Thailand. I talked to them and they sent me information, but I was not very much convinced of the process. It was very different from what you do here. It was done with stem cells that came from China, and they do physiotherapy, they do acupuncture, but what they said, and it was unbelievable, that it's a rare condition, and they cannot tell any promise of results. And because of that, I refused to go to Thailand. And when my wife tried to talk to you, she expected that I will refuse again. But I started seeing your videos in the internet, and I saw that it was different, and they explained very well what was the treatment and what kind of diseases you treat here. I expect not very much. I'm not expecting to improve or walk again or something like that, but I expected to have some kind of improvement. In the few months, my main goal, as I told I think it was Dr. Nina or something like that, when I talked to her by Zoom, my best goal was to lower the level of my condition and have some kind of improvement in the control of my sphincters, which is something that I don't have now. So I have, since I have the stroke, bladder catheter, I have no controls in the anus. I have to take some medication to improve my bowel movements, and the rest is vitamins, and with the counsel of my psychiatrist and my friend also, he told me that best to take some antidepressants in a lower dose to help me to resist to all these changes in my life. I got the incapacity of 86% to the national insurance, service, and it's like that. I have to walk on a wheelchair every day. My daily jobs is in the morning I have someone to help me to do my hygiene and to change, help me to clothe. I go to my wheelchairs. I stay for about 3-4 hours doing part of my job in the computer and answering in the computer to other things.
You're working for an insurance company, right?
Yes, the big insurance company in Portugal. And I work with them. Then after lunch, for about 3.5 in the noon, I stay in the bed. 3 times a week, I do physiotherapy at home. I have a personal physiotherapist that goes home to improve my movements, do passive and active movements. And I stay in bed for about 3-4 hours. Then I go again standing up. I go down, I dine, I sit on TV, I play with my dogs, and that's my life till this moment. But because I've talked to your doctor and I see the videos, I say to myself, I should try. Here, I'm very pleased with everybody. Every personnel is very, very kind, always looking if I need something, if I'm looking how the treatment is going, just always trying to help me. I have nothing to complain about that. Of course, it's not a pleasant therapy because I have to do things all on the vein and I have to have a catheter and I have to change catheter. One of the things that they did not know in the beginning, it was if I would do a spine injection to collect cells and then to do it again. But on the first day, Dr. Lisa called the anesthetist and he suggests and talked to her. And I know that they have both a discussion about that. And they said that the risk of doing that could not justify the procedure. So we decided both not to do that procedure and do all the treatment on the vein. And that's all.
Well, I know that you're a doctor and
Yes.
surgeon, and you probably are well aware of stem cells potential and
Yeah.
how it can
It's something that in Portugal, for example, we don't have very good, not very good, we have not extent experience with stem cells. We have no hospital or clinic that do the procedure. And in your videos, I see that some of the procedures you do are just like in Mayo Clinic in America. I have the reports of the Mayo Clinic about that, and that was one of the things that convinced me to come here.